For any resident who's deciding on a fellowship training program, one of the things that's going to be on your mind is, am I going to see everything I need to see at a smaller program? And I think I can say with absolute confidence that you're going to see everything here and then some.
I think this fellowship has a lot to offer. When someone comes to train with us, we consider that a commitment to help them become the best cardiologists that they can be. The mentoring relationships in our program are really strong. We really care about the fellows.
It's been really exciting to watch the growth of our program. We've really expanded our team to represent a lot of the subspecialties within pediatric cardiology.
Well, specifically in cardiology, we'll have a lot of new imaging modalities here. We have a new advanced MRI machine for cardiac MRIs. We have a new CTA scanner to do special CT scan of blood vessels. And then our cath lab is also brand new.
Our fellows rotate through all the different areas within cardiology and get exposure to all the different subspecialties. When they're on a rotation such as the non-invasive imaging rotation, they begin their experience with a lot of didactic lectures as well as a lot of hands-on experience. They work both with the sonographers on different views as well as with our physicians. So over time, they learn not only the really complex technical aspects of performing an echocardiogram, but also the aspects of interpreting that echocardiogram and the pathophysiology of the patient.
The good thing about it being a small fellowship in terms of cardiology is I get my hands on everything. Cath cases, EP cases, when I'm on service I have a lot of direct time with the attendings. When I'm in the ICU I get to kind of run the show. And when I'm on echo I can either be the one doing the echoes or I can be the one reading them. So I kind of get to choose what parts of my day I want to do depending on what rotation I'm on, which is pretty unique.
The vast majority of our patients are within the main children's hospital. Our NICU is housed within Hartford Hospital, but is a Connecticut Children's NICU. Currently, they are building a whole new tower, and so we're really excited to expand. The vast majority of diagnoses are now in fetal life for patients with complex congenital heart disease. And so we have been growing our program. We now have a fetal coordinator within our fetal care center. There are dedicated fetal sonographers that do the imaging. And we have dedicated a small group of subspecialists in fetal cardiology that interpret the echo and provide counseling to the families.
We have amazing research opportunities. There are opportunities for clinical research. For anybody who's interested in bench research, there are relationships with Jackson Labs and the University of Connecticut, and we have strong relationships with other regional hospitals for multi-center research endeavors.
We did a literature review looking at health outcomes and how there are significant disparities from fetal life through adulthood within the field of cardiology. So we've been looking as a community to see why those disparities exist and try to identify interventions that could improve outcomes across the gamut. I am the chair of the Health Disparities Working Group through the New England Congenital Cardiology Association. This is a consortium of cardiology programs throughout the region. Fellows have the ability to apply for training grants through that program, as well as participate in multi-center research projects.
I think there's a really strong community among the trainees, the fellows at the hospital, and then among the attendings too. We'll eat lunch together, we'll hang out outside the hospital sometimes together, whether it's trivia night or karaoke night. I mean, Connecticut's a great place. If you're willing to get in the car and drive an hour or two, you can get to the beach, you can get to skiing, you can get to beautiful mountains, and foliage season are really close to Boston and New York too.
I would say, we're a tertiary center, but we kind of have a community feel, so you don't feel like you're lost in the cog of some really large, overwhelming hospital. You still have access to a lot of the advanced stuff that's out there, but you have people that you can go to and feel comfortable, approaching face to face.
I think we find a really good balance here of supporting a fellow when they need support and giving enough autonomy. Right? It's important to be a freestanding, fully functional cardiologist at the end of the training. We give space where that's appropriate, but we're always there to back up. It feels good to train that way.